fighting literally from the front. He's the chairman of Max Healthcare, the chain of Max Hospitals. Joining me live right here via Skype is Abhay Soi. Abhay Soi, good afternoon. Welcome to ET Now. This is Nayanthara Rai, working from home. Something I can afford to do despite being an essential service. But kudos to the entire team of doctors, nurses, paramedics, support staff at hospitals like yours who don't have a choice. They're working literally 24/7. Abhay Soi, can you tell us, the viewers of ET Now, what has been the simple mandate that you have first of all given across Max Hospital as India fights coronavirus?
First of all, thank you. I mean, I do accept the kudos on behalf of my team. Like you rightly said, we have the privilege of working, for the country, for our fellow people. And as I tell my team, it's not so much about working for the country alone. It's also about something which is going to define us at this point of time. It's going to define our character for the rest of our lives. So thank you for having me on this show. And, as we go and prepare ourselves, for this fight against Corona, we are essentially looking at creating some sort of battle formations with our facilities at this point of time. Essentially because, in Delhi, NCR particularly, we have a geographical concentration of hospitals. We've got 11 of them over here. And unfortunately, all the hospitals in India, be it the public sector as well as the private sector, we have some inadequate amount of personal protection equipment. So rather than having inadequate amount of equipment across all hospitals, what we are doing is we are focusing on our efforts and the equipment and materials that we have on very few select hospitals, which will be on the front line of the battle against the COVID, whereas the other hospitals will be kept as clean hospitals.
Okay, so in the ones that are battle ready, can you tell me, and this is things that people want to know about. For example, Maharashtra is turning out to be a hotbed when it comes to coronavirus. You've seen lots of cases in Noida, for example. It's spreading to Meerut, etc. But where you are battle ready, does it mean that the whole hospital is only for fighting COVID-19? The reason I'm asking you this is, in the first address Prime Minister Narendra Modi made to India, he also appealed that don't go to hospitals unless it's absolutely necessary. Start cancelling your elective surgeries, start cancelling consultations. Let the hospitals be ready to fight only COVID. So having said that, does that mean that these battle-ready hospitals are only for corona?
No. So let me be clear. I think first and foremost, it's absolutely right. Times like this, elective surgeries should be cancelled or postponed. Particularly, it's not only when you go to the hospital that you can catch infection from COVID patients as well. But even post-surgeries, your immunity is down. And when the immunity is down, you're bound to even catch COVID when you're out of the hospital. So, I mean, absolutely rightly so. Elective surgeries should be postponed at this point of time because also infrastructure is limited and that limited infrastructure can be put to good use. Having said that, 25% of admissions in hospitals typically, be it the private sector or the public sector, is through emergency. And so therefore, we need to have at least 25% of the beds will always be occupied by cases which come from other ailments other than COVID as well. I think the proposition really is you need to cohort. You need to cohort the COVID patients and you need to cohort the non-COVID patients. Because one of the few things that we have going for ourselves as a country right now in this fight against COVID, which is the global battle, is that we have an opportunity. We have an opportunity to learn from the pitfalls and experiences of some of the other more developed healthcare systems, in the world. And one of the problems which was faced by Italy and which happens to be one of the best systems in the world is they cohorted patients, and therefore you had a very high level of mortality over there. And I think that's clearly a pitfall we need to avoid. So what I'm suggesting is that we should have certain hospitals which are non-COVID hospitals, and essentially what you're going to do is cohort 25% of your capacity over there, while you can have 75% of your capacity for COVID patients in that case. Essentially what you're doing is for every 4 hospitals that you have, you'll have 1 COVID and you'll have 3 non-COVID hospitals. Sorry, the other way around.
I got it. I got what you're trying to say, the ratio that you guys are trying to follow. But Abhay Soi, the other thing I want to ask you is, and you're talking about learning from those countries where you started seeing the peak cases or where you're seeing the curve starting to flatten out. Something that, we want to talk about back home, and what are the big lessons? Your doctors, your nurses, your administrative staff, your paramedics, all of those working in the hospitals are vulnerable to coronavirus. There's a lot that is being said that they perhaps are not getting the attention that they should be. I'm not saying that's the case at Max Healthcare. I'm not saying that for a second. But I want to understand from someone, a stalwart from the healthcare system, is that impression indeed right? And is it being corrected? Is it being changed? For example, over the weekend, we read this entire story about a leading surgeon in South Mumbai and how he, along with his family, are struggling with coronavirus.
Look, I think, anything from 10 to 15% of all people infected by the virus are healthcare workers. I think there's no question about that. The only defense, look, the soldiers in this battle are the healthcare workers. The shields that they have are the personal protection equipment. And I think, it is incumbent upon hospital management systems, hospital players to ensure that you have adequate personal protection equipment in place. I'm very clear. We will only open as many beds as we can, safely provide our patients, our safety gear for our own people. And, because both the safety of our patients as well as the safety of our healthcare workers is very, very important to us. Having said that, there is a paucity across the country for personal protection equipment, and therefore the need to focus your energies in, and especially at a time when COVID hasn't really ramped up to the extent one was anticipating. I think we can build our reserves, we can build our stocks, and rather than insulating, and fortifying every hospital over there, we should fortify the ones which are going to be at the front end of this fight against COVID.
And Abhay Soi, something else that you probably have to grapple with, as a chairman at Max Healthcare, someone very senior in the healthcare fraternity is, and throw some light upon this. Where are we in preparedness when it comes to masks, to sanitizers, to PP, to all the all the stuff that you need, the basic infrastructure that is needed? Do we have enough of it? Are we falling short of it?
Look, I think nobody in the world has enough of it. Every country, every healthcare system is falling short of it. By the end of the day, there are few producers and there are many, many buyers at this point of time. So there's no question about it. There is shortage. I think India itself is ramping up capacity to manufacture it. A lot of it wasn't manufactured in India. I'm personally privy to the fact that a lot of large corporates have come together and started producing it domestically. Perhaps at some stage, the ordnance factories need to get into it and start producing it. But, there is a woeful shortage of that across the world, not only in India.
Yes, of course. I think it is like the dystopian future is here. It's the black swan of 2020. No one saw this ever coming. So you had to be underprepared, and whatever you do, you will still perhaps be underprepared. But Abhay Soi, you will also have the task of making sure that there are enough funds. Now, there are, of course, certain healthcare chains that will have balance sheets which will be able to fight this. There are many who may not be able to. We're seeing photographs, for example, on social media, which are showing that hospitals are far emptier than what they used to be. The report suggesting that the occupancy is perhaps down to 30 to 35%. Are you seeking any grants from the center? Is the center giving grants? Is the states giving grants? Simultaneously, you're hearing about reports also of how certain state governments, like Chhattisgarh has done it, how it wants to take over the private hospitals.
Two aspects. I think everyone has, the fight for resources, and here I call resources not funding, but personal protection equipment, ventilators, and masks, and so on. It's not only among corporates alone, it is also governments, world governments. So, today's date, if you go and try to procure any of this material from China, you're competing against the government of the United States, who's placing orders worth millions. because as this problem continues world over, there is major shortage of this equipment. And most countries either have, obviously, for good reason, banned export of these equipment because they require it in their own country, or other countries which are purchasing, be it Japan, be it Korea, be it Singapore, or Italy, Ireland, Spain, the United States. I mean, you have way too many buyers, and so that is where the paucity is. Now, as far as this wedge is concerned, which we had in the healthcare sector, is bound to happen. In the short run, people will cancel elective surgeries, and your occupancy, which has gone down to about 40% right now, will eventually, like I said, go down to 25%, because that is necessarily the mark of a threshold at which emergency admissions happen. And but having said that, this situation, this predicament can't be there forever. Simply because either you're going to have cancellation of elective surgeries, or you'll have COVID patients coming in. You can't have a perpetual situation where you neither have elective surgeries nor have COVID patients. So one of the two situations will exist. So I'm not very concerned about the occupancy levels. I think that will continue, and different governments have taken different approaches to the whole thing. In a place like Chhattisgarh, perhaps, where the private players were not able to afford continuance of business, maybe the government has taken over. In other places as well, I presume if infrastructure, if the private players are unable to operate the infrastructure, then the government will do well in taking it over and operating it. Because, look, the machinery in this battle is hospitals. The soldiers in this battle are eventually your healthcare workers. I think you need to kind of fortify both of them.
And are we fortifying that? Like you said, no one has a solution to it. 10 to 15% of what you've seen overseas are the vulnerable class is the healthcare worker, right? Now, having said that, look at India's density, population densities. Perhaps why the Prime Minister had no choice but to announce a lockdown as a preemptive move far earlier than what you have seen in other countries. Just looking at the density population, looking at how vulnerable our healthcare system also is. So my next question, Mr. Abhay Soi, is that why did it take so long for the private sector to be mobilized, whether it's for the tests, whether it is for the hospitals? And now, having said that, is the private sector firmly at the center? Is it fully supporting the center, whether it is to do with testing or to treat patients?
I think the private sector has always been standing shoulder and shoulder, has been quite eager to support the government in this. But if you actually see, till very recently, the private labs, and up till last week, the private labs were not approved to conduct tests. And even after they were approved, there were no kits available or made available to the private sector. So I think, this depended on imported kits. And now we have an Indian company which has started producing it, and that's how the kits have come into the market. So you look, the sourcing which had to have been perhaps done by the government was not done. Secondly, even as far as the private sector is concerned, even in Delhi today, you can't. The private sector is not permitted to admit patients. So look, while the private sector is ready, I don't think it's been permitted to participate. So I think there is a little bit of a gap between, perhaps we need to synchronize this better. I think the private sector is quite eager, quite keen, to participate and to stand shoulder to shoulder both with the state as well as central government.
That's exactly why I asked this question, Abhay.
Sorry. I just want to also make a very important point.
And that's exactly why I was asking this question. Is the disconnect where the center doesn't want to give permission, or the private sector was not seeking it and maybe want to just carry on with business as usual? Because the minute word gets out that, whether it is A, B, C hospital that has corona patients, nobody else is going to go there. So that's exactly what I was trying to ask, that is it a case of the private sector not wanting it, but you're clarifying and saying, no, you wanted it and were shoulder and shoulder, but you're still seeking approvals and waiting for approvals?
No, absolutely. I don't think there's any. I mean, I can't imagine a single private sector player or a doctor. By the end of the day, look, we understand what we are in. A majority of critical care in India is provided by the private sector. Okay, we are all very prepared for it. I don't think there's any gap. And I will not. I don't hesitate in saying this on behalf of pretty much every private sector player out there. Look, by the end of the day, it is about healthcare. It is about patient care is provided one disease, one person at a time. These are not moments when anybody is going to think about holding back. Please do understand that healthcare workers normally earn anything on average, between 20 to 50,000 rupees a month. And they're not soldiers at armies who are prepared to put their lives down. But at this point, they're all going to be operating in an extremely hazardous situation. And you don't do it for the love of money or commerce. You do it you do it because you have to do. You have to do what you have to do. But having said that, I just wish the government had taken a little bit of a larger view. I do find that the government healthcare workers have been insured now up to 50 lakh rupees. And, the same could have been perhaps extended to the private sector as well. It wasn't, it wasn't. I think a lot of large players are capable of providing that insurance, but a lot of smaller players in smaller cities aren't. So I think it would just be in order, be it corporates through the CSR or the government, to extend this insurance cover to the private sector healthcare workers as well.
But, I would imagine that all of you promoters of healthcare companies are at least helping your healthcare staff, doctors, nurses, paramedics by upping their insurance?
Absolutely. I think by being there yourself on the front lines at the hospitals, with the people. So it's not about, it's not about the commerce alone. It's not about insurance, but you have to be on the front line in the trenches with your teams, and I think all of us are doing that. So there's no question about it. In this once in a lifetime struggle, challenge, that every pandemic that we are all facing, I think all of us stand shoulder to shoulder, and nobody should have two thoughts about something like this.
Abhay Soi, our meeting still carrying on with the government. I'll make this my final question because, like you said, the private sector plays a critical role. I think many Indians are very upset and angry, and they don't understand why, for example, testing took so long to be permitted by the private labs. Like you said, maybe it was a paucity of the kits, but there was this anger because a lot of people, and I'm talking more about urban India as opposed to rural India, a lot of them don't go to government hospitals, right? They did not want to go. They were afraid. So my final question to you is this. Are all of you together still appealing to the government that allow the private sector to start treating patients as well? Are you offering your beds, your wings, offering to quarantine parts of your hospital, saying that let us be part of this entire fight against coronavirus?
So let me go to the extent of saying we are offering entire hospitals. We are willing to offer 3 out of every 4 hospitals that we have for this purpose. So let me be very explicit about this. Okay, so that's one. Second is because we require the 4th hospital for the non-COVID patients and emergency patients that we have. Second, as far as kits are concerned, or the tests not being done, even today, kits are in hundreds in the hands of private players, not in thousands. We are more than happy to conduct. A hospital like Max, we have 100-odd kits. We need a significant amount, and we have a capacity to do 1,000 tests. So you can imagine, we are doing 1/10 of our capacity, and I say this for pretty much a lot of the players out there. There's a huge, huge shortage of kits, of testing kits. So if they're made available, and it's not for the love of money, it's just the supply chains aren't working, we aren't able to get it.
Let's just hope, for example, the Pune company, which has come out with testing kits, we are seeing every day some encouraging reports of how new kits will enter the system. Abhay Soi, I really hope the policymakers are watching you here. Here is Abhay Soi, the chairman of Max Healthcare, saying the private sector, including him, offering 3 out of every 4 hospitals just to fight coronavirus. Let's hope the government is listening. Let's hope the government also allows the private sector to fight and be a part of this fight against coronavirus. With that, Abhay Soi, I know you have a lot to do. Thank you so much for taking time out of your busy schedule to join us here on ET Now. We really appreciate it. And from the entire team at ET Now, here's wishing you and everyone at Max Healthcare safety, and kudos once again for being a part of this war against COVID.